Driving under the influence of drugs is a serious problem. It's easy to think about drunk driving, but many don't realize common medications can make driving dangerous. These medications can have unexpected side effects. Side effects impact reaction time, judgment, and coordination. It's crucial to be aware of these effects before driving. This isn't about scaring anyone from necessary medications. It's about making informed decisions for safety. Understanding drug effects on driving is key. We all play a role in preventing impaired driving. Over-the-counter medications are readily available without a prescription. We often reach for them to relieve common ailments like headaches, allergies, or colds. While these medications can be effective in easing symptoms, they can also have side effects that impair driving. For instance, antihistamines, commonly found in allergy medications, can cause drowsiness and slow reaction times. Similarly, decongestants, while effective in relieving nasal congestion, can lead to dizziness and blurry vision. Even sleep aids designed to promote sleep can have lingering effects the next morning, impairing alertness and coordination. It's important to remember that even though over-the-counter medications are readily available, they are still drugs with potential side effects. Always read the labels and be aware of any warnings about driving or operating machinery. If you experience any side effects that could impair your driving, it's best to avoid getting behind the wheel. Remember, safety should always come first. If you're unsure about the potential side effects of an over-the-counter medication, consult your doctor or pharmacist for guidance. They can provide personalized advice based on your medical history and current medications. Prescription medications are often essential for managing various health conditions. These medications are typically stronger than over-the-counter drugs and can have more pronounced side effects. While they are crucial for maintaining health, it's equally crucial to be aware of their potential impact on driving ability. Opioids, commonly prescribed for pain relief, can cause drowsiness, dizziness, and slowed reaction times. These effects can significantly impair driving, making it dangerous to operate a vehicle while under their influence. Similarly, benzodiazepines, used to treat anxiety and insomnia, can also induce drowsiness and impair coordination. Antidepressants, while essential for managing mental health, can also have side effects that affect driving. Some antidepressants can cause blurred vision, dizziness, and difficulty concentrating. It's important to discuss these potential side effects with your doctor and follow their recommendations regarding driving. Remember, driving under the influence of prescription drugs that impair your abilities is illegal and dangerous. Always talk to your doctor or pharmacist about the potential side effects of your medications and whether it's safe to drive while taking them. Mixing medications with alcohol is a dangerous combination that can amplify the impairing effects of both substances. Alcohol is a depressant that slows down brain function and impairs coordination, judgment, and reaction time. When combined with medications, it can create a synergistic effect, intensifying these impairments and increasing the risk of accidents. For example, mixing alcohol with antihistamines can cause extreme drowsiness, dizziness, and blurred vision. Combining alcohol with opioids can depress the central nervous system, leading to respiratory problems, coma, and even death. Even small amounts of alcohol can have a significant impact when mixed with medications. The interaction between alcohol and drugs can be unpredictable and vary depending on the individual, the type and dosage of medication, and other factors. It's crucial to remember that even if you're taking a medication that doesn't explicitly warn against alcohol consumption, it's always best to err on the side of caution. Alcohol can interact with medications in unexpected ways, and the risks far outweigh any perceived benefits. Section 5. When medications collide. Drug interactions and driving impairment. Drug interactions occur when two or more medications interact with each other, altering their intended effects. These interactions can either enhance or reduce the effectiveness of one or more drugs, leading to unexpected side effects. When it comes to driving, drug interactions can be particularly dangerous as they can significantly impair driving ability. For instance, taking multiple medications that cause drowsiness can have a cumulative effect, leading to extreme fatigue and impaired reaction times. Similarly, some medications can interfere with the metabolism of other drugs, increasing their concentration in the bloodstream and enhancing their side effects. It's essential to be aware of all the medications you're taking, including prescription drugs, over-the-counter medications, and even herbal supplements. Provide your doctor or pharmacist with a complete list of your medications to identify any potential drug interactions. Remember, even seemingly harmless medications can interact with each other in unexpected ways. Always consult your doctor or pharmacist before combining medications and be aware of any potential side effects that could impair your driving. Section 6. Real-life consequences. Stories of impaired driving due to medications. The consequences of impaired driving due to medications are real and devastating. Many accidents occur because drivers underestimate their medication's impact. These accidents often result in serious injuries and fatalities. One tragic example involves a young woman who took a muscle relaxant before driving. The medication caused drowsiness, leading to a fatal collision. She fell asleep and collided with an oncoming vehicle. Another man failed to disclose all his prescriptions to his doctor. The combination caused dizziness and disorientation while driving. He lost control and crashed into a pedestrian, causing severe injuries. These stories remind us that impaired driving due to medications is serious. Even legal medications can impair driving. Prioritize safety by avoiding driving under the influence. Section 7. Protecting yourself and others. Safety tips for driving while on medication. Driving while on medication requires careful consideration and responsible decision-making. While it's best to avoid driving under the influence of any substance that could impair your abilities, there are steps you can take to minimize risks if driving is unavoidable. Firstly, always read medication labels carefully and be aware of any warnings about driving or operating machinery. Pay attention to potential side effects, especially those that could affect your alertness, coordination, or judgment. If you experience any impairing side effects, avoid driving and seek alternative transportation. Communication is key. Talk to your doctor or pharmacist about the potential side effects of your medications and whether it's safe to drive while taking them. Be honest about your driving habits and any concerns you may have. They can provide personalized advice based on your medical history, current medications, and lifestyle. Planning ahead is crucial. If you know you'll be taking medication that could impair your driving, make alternative transportation arrangements in advance. Ask a family member or friend for a ride, utilize public transportation, or explore ride-sharing services. Having a plan in place can prevent you from making risky decisions when you're not feeling your best. Section 8. Navigating the road to safety. Resources and support for drivers. Navigating the complexities of medication use and driving can be challenging, but there are resources available to help you make informed decisions and stay safe on the road. Government agencies, healthcare providers, and patient advocacy groups offer valuable information and support for drivers who rely on medications. The National Highway Traffic Safety Administration, or NHTSA, provides comprehensive information on drug driving, including the effects of various medications on driving ability, legal implications, and tips for safe driving. Their website also offers resources for recognizing the signs of drug driving and reporting suspected impaired drivers. Your doctor or pharmacist can provide personalized guidance on managing your medications and driving safely. They can answer your questions about potential side effects, drug interactions, and alternative transportation options. Don't hesitate to reach out to them for advice or clarification on any aspect of your medication regimen. Patient advocacy groups dedicated to specific health conditions often have resources available for managing medications and driving. These groups can provide valuable insights from others living with similar conditions and offer support in making informed decisions about your health and safety. Section 9. Conclusion. Driving with care, a shared responsibility. Driving under the influence of medications is a serious public health issue that demands our attention and commitment to safety. We all have a role to play in preventing impaired driving, both for our own protection and the well-being of others on the road. By understanding the potential impact of medications on driving abilities, engaging in open communication with healthcare providers, and making responsible decisions about driving while on medication, we can significantly reduce the risks associated with impaired driving. Remember, driving is a privilege, not a right. And it comes with the responsibility to operate a vehicle safely and responsibly. Let's prioritize safety on the road by being informed, making responsible choices, and supporting each other in our efforts to prevent impaired driving. For more videos like this, visit breakingchaosbuildingclarity.com. Together we can create a safer driving environment for everyone.